Greetings, distinguished panelists and participants. This is Victor Mwanza, a management associate from Africa Health Business. Allow me to welcome you to the second webinar of the Africa Health Business webinar series for 2022, themed Reimagine Building a Patient-Centric Digital Health Ecosystems Across Africa. To start off, I would like to highlight some guidelines for the session. Attendees will be on mute during the session. We request all to observe the allocated time during the session. The webinar will be live streamed on the Africa Health Business YouTube channel. The session is in English and will last for 90 minutes. Feel free to post your questions in the Q&A session and they will be responded to as much as possible. There will be pop-up polls as the webinar progresses. Participants are encouraged to tweet during the session under hashtag AHB 2022. To highlight the session agenda, we will have 5 panelists, a moderator from Africa Health Business, 4 speakers from In-Supply Health, ALM Incorporation, Vele Africa Advisory, and Ponea Health. Thereafter, we'll have a Q&A session, parting shots from the panelists, and finally concluding the session. And now, let me introduce the moderator for the day. Since 2012, Ms. Marlos Kibacha has been providing research, consultancy, and advisory services in multiple projects aimed at strengthening the development of the Africa healthcare sector. She has previously worked with the Investment Fund for the Health in Africa, which is a private equity fund dedicated to small and medium-sized enterprise investments in the health in Africa. Marlos is a co-founder and managing director of the Africa Health Business. Besides her role at the Africa Health Business, she's the founder and board member of Imarika Initiative, which is a small-scale community program that supports mentally disabled children and their families in Mukuru slum in Nairobi, Kenya. Welcome, Marlos.
Thank you, Victor. Good afternoon, morning, or evening, wherever you are in the world. I know we have people registered from all over the continent. I'm happy to be here with you today, and I'm proud to be the moderator of a very experienced and knowledgeable panel. So I'm looking forward to what they have to say today. Before I dive into the panel's discussion or the presentations, I would like to share a bit of an overview of the basic terms that we are discussing in today's sessions: digital health and patient-centric care. So very briefly, in a nutshell, and not to steal the thunder of the panelists and to go in too deep, what is digital health? Digital health is an enabler for healthcare services, or for the provision of healthcare services, but can also focus on prevention, curation, and all the likes. Very roughly, what includes it's e-health, m-health, artificial intelligence, data capturing. And what is patient-centered care? You see here on the slide is dignity, respect, decision-making ability at patient level. So if you go to the next slide, we dive a bit deeper into patient-centric care and into the principles of that. Patient-centeredness means that you have respect for the preference of the patient. So you are aware of what they want and what they have in mind. The other one is the coordination and integration of care. If you are working as a pharmacist, a lab technician, a laboratorist, a doctor, a nurse, you are working together and coordinating jointly the care pattern of the patient. Another one is the information and education. Especially at patient level, they need to be aware what is happening to them. What is the disease like? How do you treat it? What is the anticipated way forward? What are options? Another principle is the physical comfort. Ensure as much as possible that your patient is physically comfortable. Another aspect that is regularly ignored is emotional support. Disease or an illness has a big impact on a patient and their environment. And if you ignore emotional challenges that might be there, or lack the provision of emotional support, some situations, conditions might become worse, or new trends can exist in the physical discomfort. So emotional support is very important. And this also linked to the involvement of family and friends. When somebody is sick, a patient, it doesn't happen in a vacuum. You know, a patient is part of a family, of a community, of a neighborhood, of a group of friends. So it's very important that family and friends are involved in the treatment process. Another one is the continuity and transitions. When you create a patient pathway or you focus on patient-centeredness, you ensure that the whole treatment process can be continued. And if it needs to move from one facility or another, that the transition goes smoothly. And the last but not least is access to care. Patients should have access to quality healthcare, and that is also at the center of the principles of patient-centered healthcare. So I just wanted to set that stage very briefly and very high level, just before we start with the panelists. And it's my pleasure to invite our first speaker to the panel, Dr. Johnson Anyoa. He's a registered pharmacist in Kenya with over 7 years of experience in public health supply chain management of essential medicines and medical supplies at both subnational and national level. He's passionate about health system strengthening, the use of data for decision-making, building resilient supply chains, and promoting equitable access to quality and life-saving communities in low-resource setting. Dr. Johnson, karibu. I hope you can hear me, see me, and you are there.
Yes, I'm here. Thank you very much, Marlos. Good afternoon, distinguished guests, ladies and gentlemen. Marlos, can I proceed, please?
Yes, please proceed.
Okay, thank you all for finding time to join us for today's discussion. As mentioned, my name is Dr. Johnson Anyola. I work for InSupply Health, and I'll be speaking on two key service offerings that my organization has implemented in Kenya that speaks to the theme of today's webinar. Next slide. So I'll begin by a brief of who InSupply is. So InSupply Health is an East African health advisory firm that designs people-centered, scalable, sustainable supply chain solutions. And we focus on optimizing data visibility and use, workforce development, and continuous performance improvement. Next slide. So starting with our first intervention called C-Stock, community-based programs have been proven to save lives and reduce health systems costs by treating sick children close to their homes. However, stockouts of medicines continue to hinder CHV's ability to deliver services. So InSupply Health has implemented C-Stock, which is a mobile-based reporting and resupply tool that strengthens community health supply chains. So what it does, it combines mobile technology, user-centered dashboards, and impact teams. And to the right of your screen, there's a visual that illustrates how C-Stock works. So first, the community health volunteer reports stock data, that is stock on hand, whatever they've received, and what they've issued out using a mobile phone, which could be a feature phone or a smartphone. And once they've entered the data on C-Stock, the C-Stock receives the data and automatically generates the resupply quantities that they require to their supervisors, who are called community health assistants. And from there, the community health assistants pack the orders and confirm availability for pickup. So once this order has been picked, the CHVs make the journey to the health facilities only if the commodities which have been requested are in stock. So this essentially saves them time and effort once they pick their request. So the problem that C-Stock was trying to solve was especially in arid, semi-arid counties, the large distances that community health volunteers have to traverse in order to submit manual reports of the commodities they've issued. So with this data that becomes available, actionable supply chain data and decisions can be able to be made by the supervisors, the facility staff, and the county managers to improve the inventory and demand planning. So we've been able to scale or roll out C-Stock. If you can move to the next slide, we've been able to roll out C-Stock in 4 arid, semi-arid counties that you are seeing on your screen. That is Turkana, Samburu, Wajir, and Mandera, and also Siaya County. And we did this using a cascaded rollout approach, where we began with the county team who trained the sub-county teams, ultimately reaching the CHVs. And so far, we've been able to reach 4,189 CHVs across those counties. Next slide. So the next intervention I would like to spotlight is called the impact team approach. So what is the impact team approach? The impact team approach is a multidisciplinary quality improvement team that data review teams use with the aim of improving their performance of the supply chain. So the data review teams, which meet regularly, use this quality improvement approach to first interpret the data that has been reported on, that is logistics data. Then from the data that they look at, they're able to prioritize what problems the data is telling them and be able to identify solutions or interventions or actions they need to take to be able to improve the supply chain performance. So in order for the impact team to be effective, you first have to train the members of this data review team to develop, interpret, and set their targets for the supply chain indicators that they will be monitoring. Then using this impact team approach, which they are encouraged to follow, that is systematic, which is what you're seeing on the right, where they look at the data, they prioritize the problems, they do a root cause analysis to identify what they need to take action on, and they move forward with implementing. So they are encouraged or trained to follow that approach so that meetings are not just held for the sake of meetings, but they actually have actions that they follow up with. And importantly, that is relevant to this discussion is that they're empowered to use data for operational and strategic decisions. So we've been able to roll out this impact team approach starting from 2019 to 2021 in a total of 59 sub-counties across Kenya and 9 counties in particular, which I have listed at the bottom there. So in the next 2 slides, I'm going to spotlight 2 digital innovations that we've been able to implement alongside the impact team approach. The first one being the learning packages. So we were able to identify that for the data review teams to be effective, there are certain competencies that the team requires to have so that the meeting can be efficient, operational, and effective. And these competencies are supply chain skills, data skills, problem-solving skills, and organizational skills. So we were able to develop digital courses for each of those 4 competencies that I've talked about and package them into an online based modular platform, which is ultimately designed to build the skills of these data review team members to improve their use for the health supply chain data that they are reviewing. So these courses are available online and for free of charge to anyone who is interested, regardless of where you're coming from. And each of those courses has been designed to generate skills, behaviors to effectively implement that impact team approach. And at the bottom of the slides, I've attached the link where you can be able to access and sign up for any of these competencies if you desire. Next slide, I'll spotlight on another innovation. So important in data review team meetings is decision support tool, which we developed called the indicator tracking tool. So this is a simple web-based dashboard that impact team members utilize to look at the data, to extract the data for the supply chain indicators that they're tracking, which is drawn or extracted from the Kenya Health Information System called KHIS, but is visualized in a way that is user-friendly, easy to access, and interpret by the impact team members. So I've also put a link there which members can be able to access. So depending on wherever you are, county, sub-county, facility in public health facilities, you are able to access the supply chain performance of family planning, immunization, malaria, and health products and technologies, which facilities report on a monthly basis. Next slide. So as I finish, I'd just like to give 1 minute for one of our impact team approach champions to briefly talk about their experience on implementing this impact team approach. So Victor, if you could just press one so that one more step so that the audio plays.
For the first time, I've seen a plan that is really working well. As we began this project in October of 2019, definitely the reporting rates for the facilities were quite low, and we couldn't be able to know what was going on in the facilities because there were so many discrepancies from the beginning balance and the ending balances. But when the impact team came up, we were now able to do the follow-up to know when commodities are moving from one facility to another facility in the sub-county levels, to explain how patient numbers are being affected with the commodities that we have for the family planning and also for the vaccines. So the impact team has really made a big impact. From the beginning, we were around 90% in the timeliness of reporting, but the problem was not even the timeliness of reporting. The data quality was the biggest issue. Now we have seen a total change. Even the ones who are now providing us with the report are starting to own the information that they are providing in the reports because they know we have to question on the beginning balances and the ending balances.
Thank you very much, ladies and gentlemen. That is just a brief of two of the main interventions that we have implemented at InSupply. In the just go one more step back, Victor, please. So I've put a link there that speaks more to CSTOC, which is a community health intervention that I spoke about that we deployed in a number of counties, particularly the nomadic counties. So there's a brief in that link that you could read more about, as well as a brief on the impact team approach that is a data review multidisciplinary team approach that data review teams use to improve their supply chain performance. So thank you for your audience. Back to you, Marlo.
Thanks, Dr. Before we move to the next speaker, I would like to ask you, given your experience that you have, I see a pull-up question coming up. Please answer this. Which of the following healthcare challenges has the most potential of being solved through digital health? Of course, all of those have their role to play, but which one do you believe has the most potential if you had to choose one? And at the end of the session, I will present the results of you guys as participants. But just going back to my question, Dr. Johnson, I was wondering what are the key lessons that you've learned within the InSupply team on implementing a digital health solution such as CSTOC in a nomadic or remote area, at least far away from the developed cities and all. Maybe you can shed a bit of light on that.
Thank you very much, Marlos.
Feel free to switch on your camera. We've lost your face.
Oh,
Perfect.
sorry.
Thank you.
Yeah, so thank you for that question. The first lesson that we came out in our implementation is that you have to involve the users whenever you're designing an intervention that they're going to use. So many of the interventions we in the digital space, you package something and you share with the users, and then you discover this really is not working well. But especially in the nomadic setting where you have very vast terrains, you have low literacy levels, you have to tailor your solution so that it speaks directly to be able to help them and make their work easy. So involving users is very key. Then the other thing that we realized, community health volunteers in many of the counties do not get any remuneration or any payment. That's why they're called volunteers. So only a few counties have started giving them some stipend. So we were able to have reward and recognition strategies to motivate them so that they're able to actually continue offering the services that they have been providing to the community. Then the third lesson we learned that is important, I think, is simplicity. Simplicity in your solution is key, especially targeting community health workers where the literacy levels are not so good, your solutions have to be as simple as possible. And this actually played to our advantage because other implementing partners were actually interested in trying it out for other commodities that CHVs in other counties are managing. Thank you.
Very interesting and good, clear 3 lessons. One more question I have about the last part in terms of the impact team approach that you explained. I understand in supply you work with development partners as well, that might be the initial funders of the work that you do, but how do you ensure sustainability post funding period, so to say?
Okay, so thank you. I think one approach we utilized is putting the content in a digital platform so that you don't have to do trainings over and over again. So I spoke about the learning packages and shared the link there. So anyone can be able to access the resources that we've been able to train the counties and sub-counties on this impact team approach. So that was one element we deliberately did so that even after the project comes to the end, people could still access these resources to build their own capacity and actually implement the impact team approach. The other challenge that is common, especially in government facilities, is the over-reliance on incentives to meet. So we were very intentional from the word go on making our support very low financially intensive. So instead of taking people to a meeting, for example, in a hotel, we would utilize the existing forums that they have. So they were able to continue meeting in their boardrooms and also building their capacity. They were also able to build these skills on supply chain, on data use, on extracting the data, on preparing presentations, on facilitating effective data review meetings, so that even beyond the project, these skills live with them. Thank you, Marlos.
Great, thank you very much, Dr. Johnson. I'm sure we'll get back to you in the Q&A where we have participants that can ask questions. So please also use the Q&A box and type your question at the end of all the panelists have spoken. I will go through the list of participant questions. So please, if you have a question, type it in the Q&A box. It's now my honor to welcome our second speaker, Ms. Dina Mwangi. Dina has consulted over 10 medical startups, creating sales and marketing strategies for digital health applications. Her work is focused on the convergence of digital health solutions with the fourth industrial revolution technologies. Interesting to learn what that exactly is. And her Horizon project is to develop a chatbot that will use AI to predict bipolar disorder episodes. Ms. Dina, very welcome. And I'm looking forward to hearing a bit more about you and your views on building patient-centric digital health ecosystems in Africa. And please enlighten us. Welcome.
Thank you very much, Malois, for that very kind introduction. Victor? Thank you. So today I'll just give a very brief talk on the building patient-centric digital health ecosystems in Africa. And the purpose of my talk, Victor, next slide, is just to give a broad overview of what is happening continent-wide in terms of digital health. And I want to anchor my talk today on the 6 pillars of health system strengthening. While we are aware that a health system consists of all the people, the institutions, resources, and activities that are within a specific country, we know that COVID really exposed the vulnerabilities of health systems in Africa. And so the question we are asking today is now, how do we go beyond the pandemic to create a path towards a stronger African health system? And we're going to be looking at the specific strategies, responses, and activities that we can use by adopting digital health solutions to improve the overall health performance of African nations. And why this is important is that first, we will be able to improve health outcomes You know that traditionally Africa has been known to have poor health indicators, whether it's maternal health, non-communicable diseases, or infectious diseases. And we also want to look at how we can increase the responsiveness to our own health needs within our own context, because this is important. And finally, to reduce the financial burden that our populations face, especially due to catastrophic health expenditures. While there are 6 building blocks of health systems, today I would like to focus on only 3, which are found to be very relevant in terms of digital health systems. And the first one I want to talk about service delivery, particularly because our populations tend to have trouble even due to geographical challenges accessing health facilities. I'd like to touch on health system financing, as well as health workforce. Medical products and technologies are also important, and health information systems, as well as leadership and governance, because our leaders make the investments into our healthcare systems. But today I'll focus on those 3. Victor, next slide. So as Malois rightly alluded, when we're talking about digital health, it's very important for us to be very patient-centric, or to have the patient at the center of what we are doing. This means we are moving away from a medicine-first approach or a disease-first approach to a patient-first approach, creating what we call wraparound solutions, trying to address the patient in all their entirety and not just the specific disease that they're suffering from. And this means it will be important to discuss issues such as health data ownership. When it comes to digital health solutions, the patient should own their data and access their data. So think of a situation where a patient has done an endoscopy in one facility and has now gone to see gastroenterologist in a different facility, and there is no way for him to move his patient records from one place to the other because he doesn't own his own health data. It's also important for us to consider things like gender equality and disability inclusion, as well as the access to training, not only for the patients themselves, but also for the health provider. One of the other ways in which are found in Africa that our solutions are trying to be more patient-centric is to allow the individual the opportunity to validate the performance of this solution by being able to give feedback to the provider of the solutions regarding its performance and whether the tool itself is meeting the patient's needs. Finally, interoperability is something that we cannot talk about enough because we have all these silos and small bubbles of solutions that are creating impact. And we have seen that in Africa, when I was looking at solutions all the way from Tunisia to down south, Mozambique and Namibia, that there's some sort of overlap. And even within Kenya, there's an overlap of the solutions that we have, and being able to create interoperability, or what we call in layman terms, that this technology can talk to this other technology. And even within hospitals, MOPC, A&D department, specialist clinics, the ability for health information to move is one more factor in thinking about patient centricity. Next slide. So while I could give you specific examples of companies in Africa that I really admire, solutions that I really admire, today I chose to just give you some broad overview and some broad examples of technologies and the solutions that they are solving. So rather than saying that, and I have so many companies that I admire, but if I was to start talking about that, it would not be able to give you this overview, because I think some of our delegates are trying to think, how do I get into the digital health space? And what I wanted to tell them is here, these are all the different things you could think about. When you look at things like virtual care and telehealth, this concerns not only being able to access a doctor or a pharmacist online, it's also receiving preventative information. And you know that majority of our populations are, they use feature phones and not smartphones. So this looks at solutions such as SMS, text, notifications, blast messaging. And this would look like something like, let's say, dear patient X, this is a reminder that your daughter is due for her vaccination this Saturday. This is a digital health solution that's using information and patient engagement. We've seen in Africa a lot of solutions concerning provider directories, and this is either apps or softwares that show you all the doctors, this is their specialty, this is their cost, this is when they're available for a consultation. There are also solutions in digital therapeutics, such as self-help chatbots. This is an area that's like really exciting for me, particularly in the space of mental health. We've seen chatbots that are able to walk through a patient and help them to resolve their problems or to gain more mental resilience. And as Malwa rightly alluded, for me, I'm hoping in the future to create a chatbot that would be able to predict episodes, specifically for bipolar disorder patients, because this is not easy to predict. When we look at specifically the area of app development and deployment in terms of digital health, I would like to focus for Africa on open source software, because this gives us a chance to accelerate our development of apps, because we don't have to have the coding knowledge. So that means even a person like me who is not a developer would be able to use open source software and come up with a minimum viable product for which a digital health provider can now find angel investors or grant funding to accelerate. There's also a lot of work in Africa in terms of screening, monitoring, and diagnosis, which means that a patient is able to use point-of-care devices to screen for diseases, as well as monitor progression of chronic diseases. In terms of clinical intelligence, we've seen solutions, particularly in imaging. There's even one company in Kenya that's very creating a huge impact in terms of clinical intelligence and providing devices that are able to provide data for decision making, which means that a clinician will take an ultrasound or any other kind of imaging, and the device itself or the software will be able to provide differential diagnosis. So this is work that's already current in Africa. We've seen digital pharmacies. I'm sure as you're driving around Nairobi, you've seen huge posters of so many digital pharmacies asking you to just order conveniently from wherever you are. In terms of care coordination and collaboration, this is happening not only for the patient, helping to navigate a patient through a very fragmented and disaggregated healthcare system, but it's also happening in terms of creating multidisciplinary teams. So we are seeing it when, say, a cancer patient is able to operate through an application and they have their physician, the oncologist, the nutritionist, the radiologist, everybody is managing them on one platform and they can see all the results. As compared to when you go to a radiologist and they keep your data, you go to the other person and they keep your data. So apps are helping us to do that. Workflow digitization and automation is happening right now, even within regulatory bodies, within hospitals. And what this looks like is digitization of resources. You know, Africa is now slowly going through this digital transformation, moving from hard copies to soft copies. And we've seen applications that are specifically reducing provider burnout, because doctors have to keep so many notes and so many records. But we've seen applications, even in the north of Africa, where a doctor just speaks, the interaction between a doctor and a patient is recorded and transcribed into notes that are uploaded into the patient's record. So these are advances already happening in Africa, and they are quite worthy of celebration. In terms of computer-aided imaging, it's what we were talking about. We've seen that in Africa, and healthcare workforce is actually one of the pillars of health system strengthening. But you can imagine some remote village in, say, Baringo. They do not have an oncologist, or they do not have a radiologist. But when you have a software, for instance, that would allow the sharing of DICOMs between these a lower cadre provider, who could be a nurse or a clinical officer, being able to share those images to a higher level specialist, they would be able to get the support that they need. When it comes to clinical trials technology, we have really lagged behind as Africa, and you're aware that majority of the technologies we use, the medicines and the vaccines, are not developed in Africa. Majority of the times it's because the companies in advanced economies that want to work in Africa have no way to recruit patients. So even having an application that has inclusion and exclusion criteria, we've not had that before. But now through applications, clinical trials are happening in Africa. We are being able to recruit patients, which means that now we are going to have medications and solutions that are specific to our genetics. Now, in terms of health financing, this is an area that really excites me as well, because traditionally patients in Africa are excluded from the insurance providers because of the very high premiums. But we've seen solutions where patients can now save small amounts of money, including 20 shillings a day, 30 shillings a day, putting that into a pool digitally, using even solutions such as mobile money transfer. And it means that now they have an umbrella for their families. They have a protection for their families that will just sort of shield them from catastrophic health expenditures. Data integration and analytics will help us to see the trends in disease progression, even what Dr. Nyona talked about, trends in commodity out of stock situations. So this ability to bring data from multiple sources, even within a hospital, to bring in data from the A&E, from radiology, bringing data between facilities, between counties, will be able to give us the analytics that is helping Africa to make strides towards universal health coverage, considering so far only about 7 to 9 countries have fully achieved universal health coverage for their populations. Finally, I'd like to highlight home health technologies. So this is everything from, let's think about solutions we've seen where a patient comes from inpatient, just had surgery, and their doctor or their surgeon is able to stay up to date with them when they're home. How is your wound healing? What symptoms are you having? How are you reacting to your medication? So these solutions were not available even a decade ago, but now they're very popular. And I would like to wrap up this a very busy slide with all these solutions in 2 key words: that digital health solutions in Africa are creating a digital front door. And just as you can see in the picture, it's a sort of welcome into the facility, welcome to accessing your health providers digitally, and creating a sense of continuous patient engagement. Last slide. So finally, what are the tangible actions that we can take to implement digital health solutions in Africa? And the first thing I'd like to say is let's take an Africa-first approach. And this means understand the entire ecosystem, because context really matters. Then go ahead and find a simple unmet need. From all the examples that I have given, you find a simple unmet need and just start there. Iterate frequently or change based on what you're learning, and then maximize the value of big data analytics. And then finally, you just start. There is no other option other than just to start. Harness partnerships, build collaborations, and just start. So that's the end of my presentation, and I hope it has given you a broad overview of all the different kinds of solutions that have been provided in Africa. Thank you.
Thanks, Dina. Very interesting, and I think we have seen a lot, and that slide was very interesting. I saw some comments from participants also that they found it very useful. And I was wondering, out of all the examples that you showed, which one do you think, if you have to choose like one, is the lowest hanging fruit according to you in terms of adaptation and in relation to patient-centricness here in Africa?
So out of the 6 pillars of health system strengthening, where I've seen majority of the work is in service delivery, just that sense of bringing the patient closer to the healthcare provider. So I'd look at the very first solution, which is the virtual care or the telehealth, as well as the provider directories and care navigation. So these go hand in hand. The virtual telehealth will mean that you do have a directory of the doctor somewhere. The patient is able to book that doctor, and they're able to receive their care virtually. So I'd say that that's the lowest hanging fruit.
Very, very clear. And in terms of, we have opportunities, I'm sure there are also challenges. What do you believe are challenges? And as you think about that, participants, please have a look at the question 2 and answer it quickly. Which of the below attributes of digital health supports the strengthening of patient-centric ecosystems best? All are good, but which one according to you is best? And let me go back to you, Dina. What do you believe is like the largest challenge in the adoption of patient-centeredness and in relation to digital health, or digital health in relation to patient-centeredness?
So I think the largest challenge has been, especially in Africa, and in my experience, just working within communities, is challenges even in terms of infrastructure. And I mean infrastructure just in the sense that you do need for e-health, m-health, access to a device. So whether it's a feature phone, a smartphone, there has been a challenge in patients having access to the hardware that they can use to access virtual care, access to things such as internet connectivity. And when it comes to a patient-centric care, what I'm finding is that it's going to take time to make that shift, where doctors and the healthcare providers have a disease-first mentality. To being able to look at the patient in the wholeness of who they are, and be able to put the patient at the center of the solution. So I find that it's a shift, it's a culture we have had, even acknowledging the fact that patients know. I was reading papers that say that most of the times for the urban educated, by the time they show up to the doctor, they've already researched their symptoms and they have an idea. They're doing the differential diagnosis with the doctor. But it's going to be an entire change within the ecosystem where the healthcare leadership, the providers begin to change their approach from their policies, the disease-first approach, the medicine-first approach, to turn around and change it to a patient-centered approach.
Great, very clear. Thank you very much. I wrote down disease-first mentality needs to shift to patients-first mentality. And when you spoke earlier, I also know that the digital front door, I like that one. It's a good opener, literally, the door opener. Thank you very much, Dina. And I'm sure we'll get questions for you from the participants as well. And once you write in the Q&A, I forgot to mention it earlier, please also mention the person you address your question to. For now, thank you, Dina. We'll hear from you later in the hour again. It's now my pleasure to introduce to you our next speaker, Ms. Simiso Velempini. And before she comes on, let me give you a bit of a background about her experience, who she is. Simiso is an internationally recognized, well-respected African investment advisor. She has spent over 15 years advising clients on political developments, high-level stakeholder engagement, integrity risks, as well as crisis and reputation management strategies. She's the founder and managing director of Vele Africa Advisory, a London-based, Africa-focused strategic advisory firm that provides exclusive support throughout the investment life cycle to corporates, development finance institutions, family offices, and high net worth individuals. Very welcome, Simiso. I'm looking forward to hearing your experience and views on also the investments around patient-centric care in the digital health space in Africa. Very welcome.
Thank you for having me, and thanks for having me on the panel. Victor, if we could start the presentation. Thank you. So in my presentation, I'm going to zoom out a little bit more and talk about some of the market opportunities, some of the more innovative companies that are making strides in digital health provision, and look at some of the problems and potential solutions as to how we can start to create a more enabling environment for patient-centric digital health in Africa. So one of the first things that I'd like to highlight is, the entire industry, the digital health industry, has really exploded in the last 2 decades. This is due to a combination of factors, but it's largely driven by the development in the technology and data analytics space. And the amalgamation of these developments on the technological side with some of the advancements on the medical side has really created this new industry as we understand it. Morales, in her introduction, she mentioned that digital health, a good way of thinking of it is an enabler for healthcare services, but it's also in the midst of doing that has created a whole new range of different services that can be accessed. Some of the leading industries that we all know about are focused on digital healthcare tech, which also involves wearable devices that can monitor and track and relay information to clinicians, digital mental health, healthcare blockchain, which is something that we can talk about, which I think is also quite interesting within the context of ensuring patient, or rather collecting patient data and ensuring that patients have access to their data, irrespective of which healthcare provider they're approaching. Healthcare data analytics, and obviously healthcare IT. The market potential in Africa is different to that in more developed countries. I mean, the first 2 bullet points that I talked about obviously are talking about the market opportunities at a global level. But as Dina mentioned in her closing remarks, local is important and context is important. And when we're looking at the market potential in Africa, the truth is right now it largely remains undefined. And I think from some of the comments and the exchanges in the chat discussion, it definitely seems that there've been a lot of synergies and connections that have been made. And hopefully this will start to create momentum around looking to actually articulate and define what that market opportunity looks like in the digital healthcare space. But I think one thing that's important to notice is that it's unlikely to have the same characteristics as developed markets. I raise this point particularly for foreign investors that are looking at the space in Africa, but also for some people who are looking to articulate what some of these solutions will be. A lot of talk is given to the demographic dividend in Africa. And, you contrast that quite sharply with the discussion around aging populations in Europe, Japan, and the US. So when we talk about digital health, especially, we need to think about, what are the solutions? Dina mentioned, think about a solution, solve a problem. What are the solutions? What are the problems that are actually relevant in an African context? And what are people doing to solve them? And this is some of the things that I'll discuss in my presentation. The two ones that I think are quite notable and which probably a lot of people are quite familiar with are telemedicine and digital mental health. I think these two aspects have really risen in prominence in the past 2 or 3 years, and that's largely due to the COVID-19 pandemic. I think especially digital mental health, or rather mental health, was an issue and an area that didn't receive as much attention, but due to the isolation and the significant shifts in people's routines during the pandemic, during the various lockdowns, it really rose in prominence, as well as concerns about how to still continue to support those who needed chronic medication and other forms of support while being in isolation. Having said that, there are also other technologies that also sprung up in the last 2 years that I think are quite notable. We've all heard about the drone deliveries, or most of us have heard about the drone deliveries in Rwanda, medication being taken by drones and, ensure that it gets to the appropriate patients. And one area that I think is also quite interesting, and I think Uganda's made some interesting strides in that, is logistics data. So, in essence, implementing solutions that make it a lot easier to capture patient data, analyze it, and use it to inform decisions such as, what types of stocks to keep in hospitals and in clinics. The last point that I'd like to touch on is, I think there's an interesting and much needed opportunity around femtech. This is technology or digital health solutions that are specifically related to women and some of the specific needs that they have in developed markets. This exemplifies, I think some people may be familiar with, applications such as period trackers or ovulation monitors, etc. But I think it goes beyond that, and what the need looks like in an African context is very different. And I'll talk about that in one of my next slides. So Victor, if we can move to the next slide. So for those who are thinking of starting their own companies or potentially looking to develop solutions in particular areas, I thought it might be useful just to have a snapshot of the top 100 companies in the digital health space. This is at a global level. And partly why I thought it would be interesting to include this slide is just to highlight some of the attention or the focus of the larger industry players, but also to potentially start a conversation around, some of the issues that are smaller, some of the ones that I picked up, for example, around, lab testing, for example, which I think is probably of a higher need and higher importance in an African context. Clinical trials was mentioned as well as an area that I think is quite significant. But I think this snapshot is quite interesting to see at a global level. Where is the money flowing? Where is the research and development going to? And what are the areas of focus? And again, we can have a conversation about this when we have Q&A about, what does this mean in an African context, and what repositioning is needed, or what areas of focus are needed in an African context. So Victor, next slide. Dina refused to share her favorite companies on the continent. I've taken a slightly different route and thought I'd highlight some of the leading digital health interventions. Dina's presentation was really helpful, I think, in giving us the framework and the understanding of the opportunity. And I'll just drill in and focus on a couple of examples that I thought were quite interesting. The first one is Rwanda. And when we think about digital health, I think often, as mentioned in the beginning, we think of Rwanda, we think of drones. But an interesting innovation that happened during the COVID-19 pandemic was a joint effort by the Rwandan government and the UNDP to purchase robots that would follow up with patients who were in isolation. And the robots actually had the ability to do daily rounds, they'd screen for temperature, and they'd ensure that they kept medical records. In addition to these 4 robots, Rwandan government also purchased robots that assisted with cleaning locations, hospitals, and clinical locations that had high populations going through them during the pandemic. And this cleaning was done through the robots having UV lights. And I believe this has been kept on post-pandemic as well. The second example is in Nigeria, and it's Ubwena. And it was created in 2012 by students and professors from Egun State University Teaching Hospital, as well as McGill University Health Center. And essentially what they created is a mobile app that uses AI to monitor the sound of a newborn baby's breathing to detect if they are potentially in respiratory distress. And the app not only detects whether the baby's in distress, but it also looks to give location-specific advice. So depending on where the individual is located, the app will then offer some advice, either pointing to the nearest medical facility or provide support on site or recommendations on site. We're talking about some of these interventions, and I mentioned here in Nigeria, this was started in 2012. So I think something else which I think is important to highlight is a lot of this has been happening for several years. This is not something that's new in an African context. There have been trials, there have been innovations, and there have been advances that have been tried and tested at a pilot stage and launched at national level. So this is happening. This is not new on the continent, but I think we can all agree that we need a lot more of it. In Tanzania as well, there's an initiative that was created by General Electric and the Macharia Health Institute, where they provided portable ultrasound devices that were used by midwives. And essentially they initially started by training about 14 midwives to service a population of about 200,000, of which a third were women. And the portable ultrasound device, and I don't know about you, but when I think about ultrasound device, I think of quite a huge device, but this is actually a portable pocket-sized one that was solar charged and therefore fit for purpose. And then lastly, there have been developments in Ghana also around digital ultrasound solutions that allow for telemedicine approaches to digital health. So Victor, if you can go to the last slide. In conclusion, I was asked to summarize, some of the challenges around, to highlight some of the challenges that have held back the advancement of patient-centric digital health and propose some solutions. And we could get stuck on the slide for a long time. So I just focused on about 2 issues relating to each segment, and I'll just very briefly touch on them. I think at an individual level, we're talking about digital health, whereas, in some communities, even the idea of more orthodox medicine is still a hurdle to be overcome. So I think in the same way that, with other aspects of introducing different approaches, there's a degree of education and sensitization that needs to come with the introduction of new healthcare approaches. And secondly, just the access to funds to access services, having limited funds to access services. And this is something where, the state as well as donor agencies could play a stronger role in subsidizing the cost of accessing some of these services. Infrastructure challenges are acute. And when we talk about infrastructure, we mean, in this context, I'm talking about, regular electrical power, broadband access, cellular network coverage. And these are really issues that fall within the domain of the government. largely, as well as private sector to a certain extent. At its core, I think the government needs to ensure that it creates a very clear and enabling policy and regulatory environment, and encourage private sector involvement in not only the creation of or rather providing input into the policies, but also to ensure that the private sector really pushes in some of these areas. And then lastly, from the investor's perspective, oftentimes the issues around lack of clarity of the policy of the regulatory regime, and it can be met by the investors themselves engaging with the government to help them shape their policies, but also in the absence of clear policies or regulations referring to international best practice, and thinking about building a local talent pool, and thinking about being in the country for a considerable amount of time and actually investing money in not only building physical infrastructure for their projects, but also investing in the local population. So upskilling healthcare professionals and ensuring that they stay and they teach others within the ecosystem. So I think I'll pause there. That is my last slide, but obviously I'm happy to take questions.
Thank you very much, Simi. So very interesting and a good overview. I was wondering, being an advisor of investors and of investors in the African space and also in the healthcare space, what have you experienced in terms of the investors' priorities in regards to patient-centeredness? Have you seen an increase in that, or does it get any attention at all? Is it, what are your views? And as you answer that, please participants answer this poll question that has just popped up. Who should be the lead in driving patient-centeredness through digital health solutions? Select one of them and we'll get back to you with the overview. But yeah, Simi, so what is your take on what investors think about patient-centeredness in the healthcare space in Africa?
So I think when the topic of patient-centeredness comes in, I think it's often seen through the very siloed approach of a digital mental health solution. So it's seen within the context of the individual and within one very small proportion of digital health, which is specifically, mental health related. So I think that's really more where, patient considerations are really at the front of mind of investors' considerations. I also, though, would like to highlight that it depends on the type of investor that you're dealing with. I think some of the DFIs, or developmental finance institutions, are naturally more aware and more sensitized towards the different stakeholders, particularly the beneficiaries of their investments. I'd say probably more private sector focused or more private capital investors, that wouldn't be the primary consideration. That would probably be maybe a second or sometimes third order priority in their considerations. I think it's definitely up to different stakeholders who they interact with to raise the fact that one of the ways that you need to be thinking about this is putting the patient at the very center of it and ensuring that whatever you create, whatever you invest in is serving their needs, but also empowering them through the process.
Great, very clear answer. Thank you very much. And we'll hear from you later. For now, thank you. I would like to move to our next speaker. But before we do so, I want to show a video of our partner organization who made this webinar also possible. And then I'll introduce our next speaker.
When we're no longer able to change a situation, we're challenged to change ourselves, said Viktor Frankl. It's this challenge and desire for change that brought us to chart new paths in healthcare. We are Ponea, a Swahili word that means saved by a whisker. Ponea is made of heart, a genuine desire to create positive impact through transformation. We are at the heart of transforming a disconnected healthcare system, expand access for patients, and empower doctors, facilities, and other providers. Ponea is one click, one platform, and one-stop healthcare. A single touch, revolutionizing healthcare in emerging markets on a global scale. A platform where every doctor can be the best they can through digitized appointment booking, teleconsultation or in-person treatment, treatment on the go through home, office, or hotel visits, automated billing and virtual payments, medical record sharing and archiving, and a concierge service where every patient is a VIP, where we provide call center booking services, doctor calendar synchronization, fast-tracked patient convenience and assistance, simply a doctor always by your side. By deeply understanding the needs of a remote patient and the hassle of running a healthcare practice, we have designed interfaces that enable every patient to take charge of their healthcare experience and search healthcare providers, book appointments online, choose a provider for treatment at home, a facility, your office or hotel, teleconsult a doctor via video or chat, book tests and get samples collected wherever you are, get choice and options through price discovery and transparency, online prescription filling and delivery, make payments online, rate doctors and providers, and access to all your medical records, ensuring that patients can now access healthcare on their own terms. We are Ponea Health. Medical concierge services now available in Kenya. To book a doctor's appointment, call 0111 013 900. Ponea Health is a healthcare aggregator, delivering services through technology platforms via licensed, vetted, and accredited health providers.
So that was the introduction to the company that our next speaker is the founder and group visionary officer of, Mr. Michael Macharia. He's a certified accountant with vast technology experience, and that's a rare combination that enables him to follow his passion for transformation and impact. He's the founder and group visionary officer at Ponea Health, a healthcare aggregator delivering medical services through technology platforms via a licensed, vetted, and accredited health providers. And he's also a founding board member of Endeavor Global Kenya. Michael, welcome. Looking forward to hearing from you. Please take the floor.
Thank you, Malos. So I'm looking for, okay, slides, thank you. So I'll start. I think the problem that Ponea is trying to solve is sort of been mentioned by some of the participants and some of the questions I'm seeing that are popping up from the audience. At Ponea, the big idea is really to make it easy for you to get care. And really we are speaking to and that's why we relate to this topic. It's about bringing the patient at the center of the whole engagement in terms of medical services. And we all know sometimes it's so difficult to get the right care, the right time, okay? And it's sometimes even at the right price point. So if we, for instance, brought in the level of transparency and the level of ease to get care, we believe that we could easily move patients to become more preventive driven, look at more preventive driven healthcare. The other day I asked a question to a group of people, and I said, for instance, why do men, for instance, how many men do what we call preventive healthcare checks? Yet it's a very simple thing. You can easily get blood samples. Somebody could come and collect your blood samples from the house, and immediately within the next day or the same day, you're able to have your level of some test that could easily save your life, which is really driving care towards preventive healthcare. And the question is, a lot of people say it's very complex. Sometimes in their mind, they think going to a hospital, getting blood samples, trying to figure out talking to a doctor. Yet it's such a simple initiative. And Ponea is trying to bring that level of simplicity to the patient, because I think moving from curative healthcare to preventive healthcare, the only way to do that, especially in Africa, is to make it easy for patients to get the kind of service they're looking for. And most likely they're going to move towards preventive healthcare. So our big idea is to make it easy to stay healthy. Next slide. Now, our moonshot mission is to consolidate and digitize healthcare, and in 3 pillars: universal access systems, creating a marketplace, and then also building what we call a digital platform, something that a few of the participants, speakers have spoken to. How do we improve access? And at the same time, how do we improve access, transparency, and convenience for the patients. So the first thing under universal systems is really driving what we call 24/7 human and AI medical concierge. And we can go to the next slide. Now, how will we do that, right? The whole technology, move to the next slide, please. The whole technology aspect, we don't believe that technology alone, fully digital technology can drive, we don't believe that healthcare fully can be done by technology only. There has to be a human intervention. And that's why we believe that driving what we call a back office, where we have medical professionals and technical teams, would be able to help patients with that journey to move fully digital. And then introducing AI at some point in the next coming weeks, such that you can be able to have symptom checker. And today, these are products or services available globally, whether it's Mayo Clinic or other platforms that are available and have APIs that we can integrate to as a platform to enable patients to do the first level of triage themselves, such that they then can be able to figure out what's happening with them. Kindly go to the next slide. Molos. So the medical concierge for us is a significant part of driving what we call a customer engagement, but not fully digital, but a combination of digital and human interface. Then the next issue is also patient medical records, moving from one facility to the next facility. How do we, or one doctor to the next doctor, how do we create what we call a Dropbox of sorts for patients to be able to have medical records, irrespective of where they go, the medical records follow them, right? And then creating the right level of security around that to enable patients, even when they exit the system, they still have access to the medical records. This, I think, is a game changer, especially in markets where even as you move, it also enables you to not remain held or ransom to some doctors. You can easily move based on who is giving you the best service. So again, it's all about bringing value to the patient, such that the patient has options to even go from facility from provider to provider. Then also driving what you call a digital health wallet. Digital health wallet runs in multiple ways, whether or not you're funding a patient who's got a chronic disease, and you, for instance, are the caregiver, ensuring that the money that you give them, for instance, a lot of diaspora capital that comes to fund healthcare, you don't need to ensure that the money is going to the right service, and you're not sending money to your loved ones who maybe you're taking care of, and they're using that money, especially if you fund your parents. Most likely they use that money to support their grandchildren. You want to make sure that they're using that money for the intended purpose. So how do we build a digital wallet that is sticky, that can also be integrated to lenders, to banks, to insurance, to employers? For instance, in Ponea, what we try and do, for instance, in the corporate health management, we help corporates drive what we call a digital health wallet for outpatient services for the employees, where between 3 to 7.5% of the employer contribution to salary goes to an outpatient wallet. The employee is then able to use our platform, determine what kind of providers they want, price points, right? And at the same time, giving the employer and employee visibility of what options there are. That already in itself enables employees and employers to control their budgets in terms of healthcare. This, again, we think is a game changer in terms of enabling and giving control to the employee, who then can make decisions because they own the wallet, they own the decision. And even if at the end of the year, if they've not spent the money, they can be able to transfer that money to the next year. So it means it's really creating transparency, even as you build these digital wallets. Next slide. So how then do we build a three-sided marketplace? The first thing is looking at consumers. And consumers, we need to remember, and what we've learned from Ponea and from the last 2 years, and as we are launching our services now, you need to give consumers, or when somebody mentioned about the digital front door, the digital front door needs can be anything. Consumers that, for instance, patients that came to us through WhatsApp tend to remain on WhatsApp. Patients that come through the web tend to want to remain on the web. So patients that come onto the app tend to remain on the app. So what we felt is giving patients universal access from either from any omnichannel, omnichannel, whether it's web, whether it is mobile, whether it is social media, is so important because customers need to have that option. And customers come from multiple formats. If you think about it, you've got chronic patients, you've got normal retail patients, you've got patients who are supported by grants, So what Ponea has done is build a marketplace that allows different kind of consumers to come on board. The next thing is also health professionals. How do we onboard health professionals? Again, we've also realized that the whole process of vetting professionals, allowing them to understand and making them responsible and making them part of the journey of Ponea is so important. So we found that even as we onboard professional and organizations, for instance, when we built our marketplace, we've also realized that we are now helping some of the organizations adopt to international coding standards. For instance, in our backend, our whole services is built around ICD-10 and 9 and 10 and CPT coding. And also in our drugs ecosystem, we're using the ATC coding. So we've seen out of the providers on our platform, maybe only less than 5%, we have 400 plus providers on our platform, only less than 5% have adopted this kind of coding. So just by ourselves implementing this, we are then helping some of the organizations already start understanding that this could be important, because in some global, as you assume and try and build up a global platform, if you don't, for instance, adopt ICD-10 and CPT coding, it's very difficult to scale your organization. So this is, I think, also a different game changer in terms of driving change and also allowing consumers to compare like for like, because once you build around ICD-10 and CPT, then what you compare on our marketplace is like for like. Finally, in terms of ecosystem, health ecosystem partners, we've also seen partners that are coming to our platform, pharmaceutical companies, for instance, whereby as your doctor prescribes some medication, we're now giving the patient option to choose generic and the other mainstream medication, such that by the time it allows the patients to start realizing, for instance, yes, I could buy this drug for 5,000. I can also buy this generic for 1,500. What we find is a lot of patients who don't even get generic, but they don't even know the option exists. So again, giving this, allowing pharmaceutical companies to also plug into our ecosystem as additional partners is something we found as a critical, going to become also a game changer in the market, because it allows that level of transparency. Grant money, people who offered donations or grants could also use our platform by selecting the right professionals, but also the same professionals could lower their price, because we allow them to also put a price point to offer what we call lower price for grant-based interventions. Again, it's all about the provider. Some providers, for instance, on our platform, opt to even lower the price up to 75% when it's a grant-enabled ecosystem. So again, it's lowering cost, offering transparency, and also giving access to patients. And those consumers, as I said, could be high net worth consumers or even BOP at the point where they're supported by grants. Next slide. Now, at the end of it is really building what we call a global digital health platform. The providers in our ecosystem and everybody in our ecosystem, for instance, in the medical industry, we need to be able to drive content. Okay. For instance, we find that marketing, a lot of medical organizations struggle with engagement of customers, right? In terms of putting the right content for them to consume. So we then have built a content engagement platform. For instance, on our YouTube channel, we've got 400 plus videos, and we hope to build this up to 1,000 plus. By the end of the year, we're probably then going to be the largest content platform, local-based content platform with what we call very, very curated data, giving patients or allowing patients to start thinking differently about healthcare, right? The next thing is also, we then offer the same data visualization and insights to some of our providers. Where it's a lab, maybe a lab is plugged into our ecosystem. We then are able to show them how much search engines we have on medical products. We're able to know, for instance, what time people are looking for products, age groups, type of mobile devices as people are searching on our platform, what time of day. If it's a topical issue, for instance, recently there was a conversation around that was going around that there was an issue where they said that Kenyan men tend to move in towards low sperm count. Such a topical issue ran for about a week. We saw significant searches on our platform, people looking for what kind of services are available when somebody wants to understand if what kind of reproductive health services are available, if somebody wants to know they've got a low sperm count. Now, for instance, these are typical topical issues in an industry. And what most likely most of us will do, we'll go and search on Google. Now, what we're trying to do, we want to become the curated Google platform, but now at a local level, but also giving options to customers. Once you search for symptoms, you're able then to figure out where to go. Is it a doctor you're looking for? Is it some lab test you're looking for? What is the price points? Can I compare between this lab and this lab? Can I compare between this doctor and this other doctor? How many years of experience does this doctor have? How many years? What kind of publications do these doctors currently have? This gives customers significant options, and also gives the providers the amount of data they need to improve their business. And finally, everything we do, we build everything in a very open system architecture, allowing third parties to plug in our platforms. Our vision is to become a marketplace that allows third parties to connect to us. For instance, we're not in need to build a blood bank platform. If there's already an entrepreneur who's got a blood bank platform, they can plug their app or their platform into Ponea. And we then can offer that option to our customers. For instance, today we just launched our platform on Safaricom Market Store, allowing patients to have whatever services, right? But also what we've seen is that as people are looking for services, we also we sort of commoditize healthcare by figuring out what are the services you require day to day, every day, what do you need? And with those, we put on the Safaricom Market Store. So when you have a chance, just try and download that and look at some of the services you need there, really sort of driving the need, trying to drive the whole conversation around self-medication. You really need to self-medicate if the solution is available. If you can get a doctor consult as low as 900 bob, and you can get drugs delivered to your house or a lab test done in your house, then why self-medicate, for instance? So again, having an open data structure allows us to integrate whether to banks, to telcos, to other entrepreneurs, to people offering lending services. For instance, in our corporate health wallet, we allow people who give loans against salaries. For instance, an employee requires a loan to finance a certain health initiative. We allow some of those providers to then extend their lending services to customers. For instance, brace finances. If you want to have braces, 300,000, 250,000, 300,000 shillings for braces, you can pay over a year. Those are options we also give patients, right, on our platform, but also extending that open architecture to lenders who will be able to take that advantage and give our patients options in terms of financing. I guess, as this is my last slide, and our big idea is really transforming healthcare, but with the patient at the center of it. But also we realize it's a whole collaboration effort between caregivers, between providers, between the customers, between corporates, between the final payer. But at the same time, being able to at the center of the patient, giving them the experience that they need in making sure they move from curative healthcare to preventive healthcare. Thanks a lot.
Thank you, Michael. Very insightful. And I was wondering, hearing your story and rolling out this model, the Ponea model here in Kenya, what are some of the biggest challenges, or have you faced any challenges? And if what are they, and how did you overcome them?
The first challenge, I would say, was being able to simplify this conversation to a point that customers understand it and get it. And then at the back end, there's such complex tech, that enterprise tech we are building, but how do you simplify it such that the patient, when they use the mobile app, or they go to your website, they go to your marketplace, immediately they're able to understand what's going on. That was the first big challenge, simplification. How do you simplify that journey to the patient? And in the back end, you have a significant level of complexity by bringing everything together. That's one of the challenges that we've had, but we managed to overcome that based on our open architecture. The next other challenge is on convincing some of the players in the ecosystem of this big idea. But what we see is that the moment they get it, the moment they understand what we're trying to do, they immediately jump onto the bandwagon. For instance, convincing players to put their prices openly into a marketplace, initially we thought it was going to be a big challenge. But then when a few people put their prices on the marketplace, and they began doing comparisons, we found some of the labs or diagnostic centers would reduce pricing. I give you an example. Last week, one of the providers looked for us and said, look, I've just installed a new MRI in Thika, and I see on your platform, you've got new MRI at 19,000. I can be able to offer the same at 11,000. It's a Siemens MRI, 1.5 Tesla, and we will be able to offer it at 11,000, including 1,500 shillings for patients coming from Nairobi. We'll pay for the Uber. That is 11,000. That comes to 12,500 vis-a-vis another provider who's at 19,000. So as a patient, naturally, you'd want you'd save 5,000 and you go to Thika and get the MRI. But if you know you're not going to queue, if you know the price point is right, you'll get it. But now some of the providers we see initially were not very comfortable providing price points, but now we see they're more than happy and then constantly comparing the prices and lowering prices because they see what's available in the marketplace.
Very clear. I was wondering, you're mentioning prices. How do you ensure quality? Pricing is one thing. How do you make sure that the quality of the participants in your marketplace is also up to par?
Okay, great question. The first thing we do, there's a significant vetting process as you onboard providers, but also there's a filtering process. So what happens when you select a product, we give customers options. For instance, you could filter by ISO certification. Yeah, in the new platform we're launching next week, you'll be able to filter with ISO certification. So for instance, if you want a lab service, you want to do some blood work and you want a lab that has got ISO certification, you can be able to pre-select and say the only lab I want is ISO certification. You want a lab that has got, you want, for instance, other options. For instance, as you filter, you want to know when I go to that facility, what kind of equipment do they have? So even in times of, we are going to go to the extent where, for instance, if you're looking for that knee MRI, you can even know the kind of modality. Is it a 1.5 Tesla MRI? Is it a Siemens MRI? The next thing also, all that information we provide patients, because with those options, then the patients can decide, is it a price issue? Is it a convenience issue? Is it a quality issue? At that particular moment, we also allow patients to also do independent feedback. That feedback, which is very transparent, once they get service on our platform, that feedback is also given to the caregivers for them to understand how patients are rating them.
Very clear. Thank you, Michael. And with that, we also already moved actually into the Q&A session. And I have some questions here in front of me from the participants. And since your screen is still open, Michael, let me take some questions of participants regarding Ponea and your presentation. The first question I would like to ask is Ponea a mass market product? Who pays?
Okay, the Ponea is, I would say, is in two ways. It's first, it's an outpatient-based product. So we don't do any inpatient services. I would like to clarify that. Our customers range from very high-end customers to what we call middle class, upper middle class, or lower middle class customers who could afford, so anyone who can afford a 900 shilling doctor is our typical customer. But subsequently, we've moved into a grant-driven process or what we call mini donor-driven solution, where we will be launching a donor platform that allows you as Mrs. Kibacha to be able to commit X amount of funding per month to somebody who is needy. So for instance, you want to commit 5,000 shillings, you'll say on our platform, we go and pre-select, you want to fund maybe teenage pregnancies, and you want to help teenage pregnant. You want to help teenage mothers with mental health. So for instance, you could say, if somebody comes to our platform, doesn't have the money for that kind of teleconsult with a psychologist, please reach out to me. So immediately you receive a notification, we give you the information about the patient, and you're able to then contribute immediately, or at the point where you're able to know that this patient will receive care. You then contribute X amount of money into our platform and the patient receives care. So in that way, we're also addressing lower end people who may not have the capital to fund or get into Ponea.
Okay, great. So in terms of payers, individuals who pay, is it also the insurance firms that pay, or the hospitals, or?
We pay, it's individuals. A lot of it right now on our platform is self-paying, cash paying, okay? And then now we've got what we're going to be moving into insurance. I think the first thing we found interesting, it has taken insurance companies quite some time to understand what we're trying to do. But sometimes they think we are competing with them. They say we're not an insurance company. We tell them we're just trying to enable your customers get better value, right? So what I found very interesting, it's the insurance industry as it speaks today, it's taking them a long time to adopt to this. It's like launching M-Pesa and getting banks to accept that M-Pesa will be there, right? Doesn't mean you're competing with you. It means eventually today in every bank platform, M-Pesa is embedded. So we are talking to insurance, telling them we're not competing with you guys. We're just trying to bring better value to your patients.
True. Very clear. Thank you, Michael. I'll come back to you with other questions. I would like to just go now to the first presenter, Dr. Johnson, with a question from participants. I hope you're still there, Dr. Johnson.
Yes, I am.
Yeah, great. So let me read this. What is your funding model? There seem to be a lot of startup costs. Is that paid for later by user fees, government contracts, or something else? Also, in the 4 areas you work in, have you replaced what was there before, or do you work with it? Are you the only supply chain initiative in those areas, or are you competing against other modes of supply? This person is curious how you will financially will survive. So a lot of questions in one. I hope you can answer it briefly, given the time we have, but please take it away and feel free to switch on your camera so we can see.
Okay. So first question, funding model has largely been dependent on donors, and the solutions that we've tried out were sort of pilots to test their viability and scalability. So the end goal is to develop solutions that are sustainable and scalable, but the seed capital is from donor funding. Could you say the second question again?
Are you the only supply chain initiative in this area, or are you competing with against other modes of supply? Like you have competition in what you do.
So we don't look at it like competition. We like collaborating. That is one of our strengths, I believe, and also not starting from scratch or building new systems or platforms. For instance, a good example is the impact team approach I shared, where we leverage on existing data review teams that are there at subnational level. So they're called sub-county health management teams, or at the county level, county health management teams. And again, the emphasis is to make sure that the sustainability is embedded in the implementation.
Very clear. Thank you, Johnson. I have another question for Simiso. In the cause of engaging stakeholders and partners to stimulate investment in the health sector, do you also carry out risk communication to reinforce your message? And if yes, what does that look like, or what components do you touch upon?
Sure. Can you repeat the first half of the question?
In the cause of engaging stakeholders and partners to stimulate investments in health, do you also focus on the risk, and do you communicate the risk? And if yes, what do you communicate?
Yeah, so I think in terms of the risk, a lot of it, there's obviously the unavoidable risks which are just present in different jurisdictions. So depending on what part of the value chain the investor would like to focus on, some of the risks that might be articulated include some of the infrastructure challenges, the human resource capabilities, what the legislative environment allows, does not allow, or is silent on, as well as potentially looking to see if there are any legacy issues surrounding what it is that they're trying to initiate. So say, for example, there'd been another company that had tried to do the same thing in the particular region that they're operating in. Did something potentially go wrong that they need to be aware of before they come in? And so those are some of the things that we would highlight. And then I just also like to stress, we don't look to discourage investors from investing in the continent. I mean, the presence of risks in itself is not a deterrent to investment. I think if it was, there wouldn't be so much money flowing into the UK, but given the political situation right now. But I think in terms of risks, I think it's always important to help the client understand that these may be some of the issues, but these are some of the mitigating measures that you can implement to help you navigate that space.
Great. Thank you, Simi. So, Dina, one question for you that I'd like to ask. You mentioned, we have a fourth poll question. Participants, please fill it in, then I'll shortly come to the results. Dina, I have a question. You mentioned in your slide, and you kept it quite generic, but you mentioned there are some companies in the digital health space in Africa that you really admire. Maybe could you mention one or two examples and explain why?
Hard pressed to pick on one, but I definitely admire Alm Inc., which is a company that I've worked for, just because of the focus that I've seen them having in terms of patient centricity and in building solutions where they took a lot of time to first listen to the patients. And it was a huge financial investment to go deep into the counties. If we've gone into remote corners in Nandi, in Baringo, Kajiado, in Loitoktok, and just engaging stakeholders to hear from them what kinds of solutions are they looking for. And then being intentional to build solutions that respond to them. And then going back to them again and asking, do you feel like this need that you have has been met? So definitely I'd have to mention Alm as one of the companies that I found coming into Kenya and making a huge impact. I have so many, but I think I can mention Antara Health again, just in terms of patient navigation, what they're doing in terms of patient navigation, because I find this is a very disaggregate market that we are in. When I worked as a medical representative, I didn't know that this was patient navigation and I should charge people for it, honestly. But people would call me and say, I'm looking for a rheumatologist or an oncologist or a gastroenterologist. People would never know where to find these specialist doctors. So I'd tap into the networks of med reps and ask, where should we guide this patient? And then it would be up to us to also go there and talk to the administrators and see when can this patient come? Do you take insurance? When can they come? It's been very disaggregated. So I find that Antara Health, with what they're trying to do in terms of patient navigation, to me has been inspiring.
Great, thank you very much. I'm just keeping an eye on the time and noticing that it's 5 o'clock here in Kenya. I need to wrap up this session. I find it very interesting. I've learned a lot and I've written down some keywords that I've seen across from all participants. I think it's a convincing and creating an understanding of the recipient or the stakeholder, the partner that you want to work with. In order to do so, you need to keep it simple. Even though there's a very difficult, complicated system behind it, please communicate simply to the end user and the user in between. Also, I've noted that you need to create a frequency in communication and a rhythm of it, so that you ensure that continuous engagement, which also will increase the understanding of the product, and data is key in all of this. So those are my key undertakings that I've taken out that were cross-cutting from all participants. I hope you've all filled the poll questions because I would like to show the poll results. I hope our IT team has them ready in the following slide. Victor, Bilda, do you have the slides for the poll results? Oh yeah, sorry, before I go there, I just want to give you 1 minute of parting shots to all of the participants. Dr. Johnson, please keep it brief, keeping time in like 30 seconds to a minute, some parting shots, your key takeaways. And I hope I've not taken some of that away already.
Okay, first of all, big thank you to AHB for convening this. It's a great privilege to speak in this panel. My parting shot is that listening to all the presentations today, it's evident that there's been a lot of investments in the region towards implementing digital health solutions. Just to encourage us that as we design and as we implement these solutions, we have to keep the use and the user in mind. I think a lot of data is available, a lot of solutions are available, but we have to also promote that data use culture so that we now move to the next level of utilizing the data to improve our systems and ultimately offer services that are beneficial to the patients. Thank you.
Very true. Thank you very much. Dina, I see you're there.
So my parting shot would be that in order for us to build patient-centric digital health ecosystems within Africa, we really need to tap into the inherent knowledge of Africans on what is needed in Africa, and because we are able to create, hyper-local solutions that are context-driven. And I'd say that there's no shortage of skill or will in Africa. Therefore, investors and Miss, when you speak to them, you should tell them to come to Africa and work with Africans because you have the skill and the will. Yeah, thank you.
Thank you very much. Simiso?
Yep, thank you so much. I'd like to highlight, I think, the importance of thinking of it as an ecosystem not just of provision, but of stakeholders. Patient-centric healthcare is important, but I think we can only achieve that if all stakeholders are committed to that outcome. So that means governments need to talk to the private sector needs to talk to donors need to talk to traditional authority structures in the communities that they operate in. And I think everyone must be looking to achieve the same outcomes, have that codified and hold each other accountable. I think the last point, and I think we didn't really touch on this, and something which I think I would definitely like to see is probably more research and development into some of the traditional medicine and traditional healthcare approaches on the continent. I think that hasn't been documented, codified, or shared as much as it could be. And I'm sure that they're great innovations and cost-effective solutions to challenges that can be found there.
Great. Thank you very much. Now, last but definitely not least, Michael, and on behalf of Ponea as well, who has been our partner for this session, and I think a very suitable partner given the solution that they offer and the focus on the patient that they have. Michael?
Yes, I think the journey ahead is great. I think we're very excited about what we see, and also what is also making us what's also quite exciting is some of the providers as they onboard our platform, and they also start realizing that they need to be extremely transparent and also lower pricing for the patients. I've seen reducing cost is a big driver. So, and then also issues of transparency. So quite encouraging. And as we scale our business into other markets, South Africa and other markets in Egypt, we are quite excited to have used Kenya as a launch market. It has taught us a lot. There's a lot of learning in Kenya, a lot of competitiveness, but also a significant way in which the experiences we have in Kenya, we'll probably take them to other markets as we scale.
Great, thank you very much, Michael. And I think also the solution that you provide as Ponea links very much to the collaboration aspect and involving all stakeholders, because all come together in your technology solution towards providing patient-centricness. So I hope you've all noted the Ponea contact details in the chat or on the slides, and we will be preparing also a conference report. And if you would like to be linked to Michael and his team, please, if you've not been able to catch his information, reach out to our AHB team. We're happy to connect you. So thank you very much to all the speakers. I've learned a lot, and I'm actually also looking forward to seeing the poll results to see what the participants have responded to the question. So the first question we asked was, which of the following healthcare challenges have the most potential of being solved through digital health? And data is the key one, data and interconnectivity. So ensuring data capturing throughout the medical chain, so to say, I think is with 54% the highest. Very interesting. Health financing doesn't seem to be a high priority or the highest potential here, followed by lack of transparency, HR, and then geographical access is also a good second one. So let's go to the next question. Which of the below attributes of digital health supports the strengthening of patients' ecosystems best? So here we have a bit of we have a clear winner. Expanding access to care in remote and rural areas, the obvious one, the geographic barrier. But the second one is ensuring affordable healthcare by reducing costs for the patients as a good second one. The lowest response was to the fostering awareness and education of medical conditions that disease management has at the patient level. So very good answers there, and gives us a good insight to see what participants of our webinar are thinking. The next question, I think that's the last one. Who should be the lead in driving patient-centeredness? Now I see a very big green one. That's the national government with 64%. So I hope there's some people from the government here. If not, we should bring that message clearly to our national governments. You can make a picture or a screenshot of this slide and go to your governments or your ministries to inform them about this. And of course, that is happening in partnership with the private sector, development partners, NGOs and civil society, patient groups and the likes. but it's a very clear stewardship role here identified for governments. I think that is all from our end, but not before I have made you aware of our new, our next session in September. We are also going digital, people. You can see the QR code there where you can use your device and scan it and register for the session we are holding on the 22nd of September, which is going to be focusing on vaccines, therapeutics, and diagnostics, and especially in the field of manufacturing of all those products in Africa. And I also wanted to share the next slide with you to make you aware that we are hosting the Africa Health Business Symposium on men's health. And we've already had some interesting discussions about that and how the role that digital health plays in that patients and the patient behavior, or the care-seeking behavior of men. Digital health can be a great solution in that, especially as we are talking about mental health, reproductive health for men. Sometimes the barrier to go to a clinic is quite high, and digital health can bridge that gap. So please save the date for 24th November. We're going to have it here in Nairobi in Kenya. And we're also making it available for online. If you want to partner with us as an organization, as a sponsor or a speaker, or contribute in any way, feel free to reach out to our team and contact us. But for now, keeping time in mind, we have overrun by about 10 minutes, but thank you for staying with us to the end. Here's HB's contact information. Feel free to reach out if you would like to know any more. And left nothing for me to say but to thank you, give you a good night, afternoon, or remainder of the morning, wherever you are. Thank you, and see you in September.
Thank you. Bye.
Bye-bye.